Hello doctors, this is Dr. Fazeela. I'm a graduate, just wait please. I'm a graduate of King's College, London, doctorate in medicine, practicing in Dubai and Islamabad. We have been hearing lectures since yesterday about the treatment of acne scars, and as you can see from the topic here, it's yet another treatment modality for treating acne scars, but in skin type 4 and 5, the darker skin type. The word ablative area laser might not be a familiar word for most of the dermatologists sitting here. Fractional lasers, radio frequency, as we had a wonderful lecture from Dr. Abid. I think one of the doctors spoke a little while ago about subcision. We've been hearing lectures from Dr. Baji yesterday using chemical peels in ameliorating the appearance of acne scars. But this word might not be familiar. How did I got versed with this ablative laser was a couple of years back, like everybody else here who are practicing aesthetics. We have an armamentarium of lasers, radio frequency tools, different very fancy kind of devices. We make our patients happy when it comes to the acne scar treatment, but do we make them feel ecstatic? Do we make them jump through the roof by using the combination of treatments, the treatment modalities that we have been talking about since yesterday? Let's agree, it's not true. They're happy, but they're still whining about having those acne scars on their faces, and you're still being pushed to find new treatment modalities. So I dared myself using one of the strongest lasers that we doctors have in dermatology, and that is not less than using a laser gun. This is a gun, doctors. This is ablative erbium YAG laser. Now, the other word that's very familiar is subcision by a needle, and you have been hearing about it since morning. But then the other word that you might feel is a little new terminology for you is removing the fibrotic tissue by using electric current, which is fulguration. So I'll explain it to you, these three things and these three procedures, that how I have made a combo out of these treatments and how I have treated acne scars in my patients, which is mostly skin type 4 and 5, darker skin. Again, we are concerned about one thing, whether it comes to the treatment of melasma, whether it comes to the treatment of acne scars. When we are choosing our treatment modalities, what's the first thing that comes in our head? Am I going to give my patient a post-inflammatory hyperpigmentation? Am I going to make the skin darker when I'm going to treat them? Yes, let's admit, we all have that in our mind, because that's something which is a challenge, and that is something we have to keep in mind when we're choosing the treatment modality. There are various treatment modalities, we have gone through them. You name the chemical peel, surgical excision, fractionated radio frequency, plasma technology, ultrasound. We are loaded with the treatment modalities. And one thing that I think Dr. Abid mentioned was that you have to use a combo of treatments. But even by using this combo, you know what? We're not making our patients ecstatic. We're not making them too happy. They're all right, but they're not very happy. So the gold standard that I have learned over the passage of time is to use the ablative erbium YAG laser. Fraction lasers, we all have been using, we are still using, but when the patient comes to you and you read the psychology and you have a word with them, and they want a dramatic effect, and they want the word, you will remove my scars, doctor. You're not going to reduce them, you're going to remove them. So you take your gun out and you're ready to take down the acne scars. In my clinical trial, we had 14 patients, anywhere from the age of 19 to the age of 45. 5 things were ensured in all the patients. They did not have a history of keloid, very important, because this is a laser gun. You're going to dig deep in their skin and you're going to scoop out the atrophic scar tissue. You have to make sure that they do not have a keloid formation tendency, number one. Their acne was controlled. You have to control acne. You know, even when we're talking about the chemical peels and the radio frequency and the other treatment modalities, you have to make sure that the patient's acne is under control. Because when you're using these treatment modalities, these are all heat devices. You can bring the acne back. So the patient should always be on oral antibiotics or oral retinoids. But in my clinical trial, I made sure, the third point is that you have to take them off the oral retinoids before you actually start digging in their skin using the ablative laser. You can prophylax them with antibiotics. You have controlled acne, but you still need to make sure that for the next 1 week to another 2 weeks, till their skin is healing, you prophylax them with oral antibiotics and antivirals if necessary. Do not forget to ask them about any history of having herpes simplex infection if you are using this laser gun. I think that's the next word. I'll use laser gun word from now onwards. And on the day of procedure, yes, they were prophylaxed with the antibiotics and antivirals, pre-operative and post-operative instructions. They were strictly followed, so I'm not going to go into the details of that. We all know how to take care of the wounds. As I said, we had 14 patients with moderate to severe atrophic acne scars. Skin type was 4 and 5. They were given topical anesthesia, but trust me, it doesn't work well. So you have to give them xylocaine intradermal injections and nerve blocks if necessary. Now these were the parameters used for my patients. The Mg was 800 millijoules. That was the strength that I used. Now, the spot size is 3 mm, frequency means the speed, doesn't really matter, but what really matters is that when you're using this gun, there are different kind of modes. I'm not sure how many of you have come across the ablative Arabian gag laser. Can you raise your hands? So very few people, and I think we are the daredevils. And we make patients very happy when it comes to the treatment of acne scars. So when we're using this gun, there are different modes. One mode is called the short pulse mode. What does that mean? That means that you're going to ablate your skin, you're going to scoop out the skin by layer and layer, but you're not going to create a deep thermal effect in the tissue. You're not going to let the heat trap up. I'm trying to use very simple words to make you understand. So you have used the short pulse mode. You start shooting your laser gun at the skin. You take layer by layer the skin, and you're going down in the skin, and you go down till you see the pinpoint bleeding points. So that was the criteria. So you're trying to go down using the short pulse mode till you see the pinpoint bleeding points. So what was next? The next was to change my mode, and I used the long and a few patients extra long pulse mode, in which I was trying to create coagulative effect in the tissue. When you do coagulation, what exactly you're trying to do? You're trying to create more collagen formation in the tissue. And the job was done. The residual thermal damage zone was created. I think we have a video. Would we be able to play this? Okay. Then the normal thing, the thing that you must have read from the topic of discussion was that on one side of the face, I exposed, yes. So you can see we have started shooting the gun. By the way, it's just not going to happen all over the face in one go. You have to spend time. So when I'm doing the scars, let's say even on the cheeks, it takes me almost 3 hours to complete the procedure. So you keep on going down using the short pulse mode till the pinpoint bleeding points they happen. And then on one side of the face, I did subcision using an 18 gauge needle. I'm not going to go into the details of that. There was a doctor a little while ago. She said how the hematomas are formed and how the platelet growth factors are derived and how the new collagen starts forming. So I'll just wait for this video to finish. See, this is the pinpoint, bleeding pinpoint. So this is when you stop using the short pulse mode, and then you switch on to the coagulative mode, which is the extra long or the long pulse mode. So on one side of the face, the subcision was done, you remove and you break the fibrotic bands of the scar tissue, which is tethered and which is keeping the acne scar down, and you're trying to bring it to the level of the surrounding skin, the defect. It was done with an 18-gauge needle. The procedure that was shown by the doctor, I'm not going to go into the details of that. And then on the other side, the fulguration was done. We all use fulguration. What is fulguration? It's a very controlled electric current device. So using that needle-like electrode, you remove the scar tissue. You can't remove the whole of the scar tissue. So basically, you have exposed it using the ablative ultraviolet laser. And now you have the scar tissue in front of you. On one side, you have broken the fibrotic bands, but the scar tissue is still there. But now on the other side, you have the scar tissue in front of you, and you try to burn and you try to debulk most of the scar tissue, and you let the skin heal. So that was done on the other side of the face. The first evaluation that was done after 1 month. All the patients, they had mild clinical improvement. The side effects was post-treatment erythema. All the patients, they had persistent redness, all of them. There was no blistering, there was no hypertrophic scarring, there was no post-inflammatory hyperpigmentation. The results after the first evaluation, I will just share so you can see it really well, but then you won't be able to see the other side. Okay, we can see that. So this is 2 months after the procedure, even after 1 month evaluation that I was talking about. You can still see the erythema. This is after 6 months. You can still see, can you see this? You can still see that this area was treated. So if we call ourselves daredevils when it comes to the usage of this laser gun, the patients, they also have to be very brave, because there is massive downtime. There can be post-treatment erythema for about 6 months. It can be also 1 year. This is the other side. You can see this. This is 1 month after the procedure. Now, when I say you have to make sure that you prophylax your patient with antivirals, I mean it. This is very important, because you have taken, it's like a chemical peel. It's like a deep chemical peel. So you have done it with a laser. You have taken all the skin layer out, and if you do not give the protection from bacteria and viruses, you are in trouble, your patient is in trouble. So you have to make sure you prophylax them accordingly. These are the results after the second evaluation that was done 3 months after the procedure. Moderate to excellent clinical improvement. The erythema was still there. Just one of my patients had the post-inflammatory hyperpigmentation. On drawing a comparison between fulguration and needling, fulguration showed slightly better improvement in the treatment of acne scars. This was, again, after 3 months after the procedure. You can see one side of the cheek compared to the other. So in my clinical experience, you can fulgurate. Oh, this was a patient, just one patient, who had post-inflammatory hyperpigmentation. But then it got resolved using topicals and the light therapies and the Q-switch and DI laser. This was my very first patient about 10 years back. When I was trying to be a daredevil, she volunteered to be the patient, and I promised her I'm going to make her happy, and I think I did. Thank you.